In modern society, obesity is recognized as a serious health threat. Beyond a simple cosmetic issue. In particular, the impact of obesity on heart health is so serious that it is dangerous enough to be called the shadow of death. In this article, we will learn more about how obesity threatens our heart health and how to prevent and manage it. Definition and current status of obesity. Obesity is generally defined based on the body mass index (BMI). If the BMI is 25 or higher, it is classified as overweight, and if it is 30 or higher, it is classified as obese. According to the World Health Organization, WHO, the number of obese people is rapidly increasing worldwide. And this is considered one of the major health problems in modern society. Effects of obesity on the heart. Obesity negatively affects heart health through various pathways. 1. Increased blood pressure. When weight increases, blood volume increases and the heart has to work harder. This leads to increased blood pressure. High blood pressure is a major risk factor for heart disease and stroke. 2. Cholesterol imbalance. Obesity increases LDL bad cholesterol and decreases HDL good cholesterol. This imbalance increases the risk of arteriosclerosis. 3. Increased insulin resistance. Obesity increases insulin resistance, which increases the risk of type 2 diabetes. Diabetes is a major risk factor for cardiovascular disease. 4. Increased inflammatory response. Adipose tissue secretes substances that cause inflammation. Chronic inflammation promotes vascular damage and arteriosclerosis. 5. Changes in heart structure. Excessive weight puts a physical burden on the heart, increasing the risk of heart hypertrophy and heart failure. 6. Increased risk of arrhythmia. Obesity increases the risk of arrhythmias such as atrial fibrillation. 7. Increased risk of sleep apnea. Obesity is a major cause of sleep apnea. Sleep apnea increases the risk of cardiovascular disease. Cardiovascular diseases associated with obesity. Obesity significantly increases the risk of the following cardiovascular diseases. 1. Coronary artery disease. Obesity increases the risk of coronary artery disease by 2 to 3 times. This is a major cause of myocardial infarction. 2. Heart failure. Obesity significantly increases the risk of heart failure. In particular, abdominal obesity is strongly associated with heart failure. 3. Stroke. Obesity increases the risk of both ischemic stroke and hemorrhagic stroke. 4. Peripheral arterial disease. Obesity reduces blood circulation in the legs, increasing the risk of peripheral arterial disease. 5. Sudden cardiac death. Severe obesity significantly increases the risk of sudden cardiac death. Interaction between obesity and other cardiovascular risk factors. Obesity interacts with other cardiovascular risk factors to further amplify the risk. 1. Hypertension. Obesity and hypertension together further increase the risk of cardiovascular disease. 2. Diabetes. Obesity is a major risk factor for type 2 diabetes and diabetes. In turn significantly increases the risk of cardiovascular disease. 3. Dyslipidemia. Obesity increases the risk of dyslipidemia, which leads to atherosclerosis and cardiovascular disease. 4. Metabolic syndrome. Obesity is a key component of metabolic syndrome, and metabolic syndrome significantly increases the risk of cardiovascular disease. Types of obesity and cardiovascular risk. Not all obesity is the same. Cardiovascular risk varies depending on the type of obesity. 1. Abdominal obesity. Apple-shaped obesity, where fat is concentrated in the abdomen, is particularly dangerous. Abdominal fat is metabolically active, which greatly increases the risk of cardiovascular disease. 2. Lower body obesity. Pear-shaped obesity, where fat is concentrated in the hips and thighs, is relatively low risk. 3. Visceral fat. Visceral fat is more harmful to cardiovascular health than subcutaneous fat. Visceral fat secretes more inflammatory substances. Managing obesity and improving heart health. Managing obesity is very important for improving heart health. You can manage obesity and improve heart health in the following ways. 1. Diet control. Calorie restriction and a balanced diet are important. A diet based on fruits, vegetables, whole grains, and low-fat proteins is helpful. 2. Regular exercise. Moderate intensity aerobic exercise for more than 30 minutes a day. 5 days a week is recommended. Walking, swimming, and cycling are good exercises. 3. Behavior modification. You need to improve bad eating habits, such as overeating, late-night eating, and emotional eating. 4. Stress management. Chronic stress increases the risk of obesity and cardiovascular disease. Manage stress with meditation, yoga, etc. 5. Sufficient sleep. Lack of sleep increases the risk of obesity and cardiovascular disease. You need 7 to 8 hours of sufficient sleep a day. 6. Quit smoking. Smoking significantly increases the risk of cardiovascular disease. Along with obesity, you must quit smoking. 7. Moderation. Excessive drinking increases calorie intake and is harmful to heart health. Maintain moderate drinking. 8. Regular health checkups. You need to regularly check cardiovascular risk factors related to obesity. Effects of weight loss. Appropriate weight loss has amazing effects on heart health. 1. Reduced blood pressure. Losing just 5 to 10% of your body weight can significantly reduce blood pressure. 2. Improved cholesterol. Weight loss lowers LDL cholesterol and increases HDL cholesterol. 3. Improved insulin sensitivity. Weight loss improves insulin resistance, which reduces the risk of diabetes. 4. Reduced inflammation. Weight loss reduces inflammation levels in the body. 5. Reduced heart burden. Weight loss reduces the physical burden on the heart. New approaches to obesity treatment. Recently, new approaches to obesity treatment have been attempted. 1. Drug treatment. There are FDA-approved obesity treatments. These have effects such as appetite suppression and fat absorption inhibition. 2. Surgical treatment. For severely obese patients, obesity surgery, such as gastric reduction surgery, may be effective. 3. Microbiome regulation. Research is underway to treat obesity by regulating the balance of intestinal microbes. 4. Customized nutritional therapy. Customized nutritional therapy tailored to an individual's genetic and metabolic characteristics is being studied. 5. Digital healthcare. Obesity management programs using smartphone apps and wearable devices are being developed. Importance of obesity prevention. Obesity prevention is more important than treatment. It is important to form healthy lifestyle habits from childhood. 1. Preventing childhood obesity. Childhood obesity is more likely to lead to adult obesity and cardiovascular disease. It is important to develop healthy eating and exercise habits from childhood. 2. Workplace health programs. Many companies operate obesity prevention programs for the health of their employees. 3. Community involvement. Community-level efforts are needed, such as designing walkable cities and improving access to healthy foods. 4. Government policies. Government-level policy approaches are needed, such as subsidies for healthy foods and taxes on unhealthy foods. Conclusion. Obesity is a shadow of death that poses a serious threat to our heart health. However, it is a problem that can be sufficiently prevented and managed with our efforts. If we prevent and manage obesity through healthy eating habits, regular exercise, and stress management, our hearts will become healthier. Your heart and your life are so precious. If it is difficult to start managing obesity right now, how about starting with small changes? Start by eating a little less tonight and going for a short walk. Small changes can save your heart and your life. A healthy weight is the foundation of a healthy heart. Start protecting your heart from obesity today. Your heart and your life will be healthier and happier. Don't miss this important health information. Subscribe, like, and set notifications right now to be the first to receive more useful information about obesity management and heart health. Your interest is the driving force behind creating better health content. Let's create a healthy future together.